They're making a difference for everyone they help, and every day I get stopped and told just how amazing they are. I'm proud and blessed to work with them, my second family.
A lot of things have been canceled, a lot of things have been postponed, but definitely not kindness. And we want to spread the kindness in our community and know that our first responders are still here for you. And thank you for staying at home for us, and we are here for you. So today we are here to surprise a little boy who is turning 9. He just moved to the county with his family and is very quiet, very shy, but has an affinity for fire trucks. And so what better way to welcome him to Hillsborough County and also maybe celebrate a little bit of his birthday by bringing one of our very own fire engines and a rescue to do a little drive-by, especially during this time.
We hear someone's having a birthday here. Is someone having a birthday here? Happy birthday, Jen.
Hillsborough County leaders and local health experts want to get a clearer picture on how many residents may currently have the COVID-19 coronavirus. To help those efforts, testing criteria has been expanded. Now, any resident wishing to be tested for COVID-19 can call 813-272-5900 weekdays between 8 a.m. and 5 p.m. to request an appointment. You do not need to be experiencing COVID-19 symptoms to receive a test, but the Centers for Disease Control and Prevention has added 6 new symptoms to its existing list. COVID-19 symptoms include fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. If you develop any emergency warning signs for COVID-19, such as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to get up after sleeping, or bluish lips or face, you should seek medical attention immediately. Call 911 if you have a medical emergency. Notify the operator that you have or think you might have COVID-19. If possible, put on a cloth face covering before medical help arrives. We encourage you to visit hcflgov.net/staysafe for up-to-date information.
Hello, I'm WWE superstar Titus O'Neil, and today I'm coming to you as a neighbor. You owe it to yourself and those you love to get tested now. Get the care you need and protect your family. Hillsborough County is offering free coronavirus testing and no health insurance is needed. It costs you nothing to get tested. Call 813-272-5900 and have a reservation made today. Visit hcflgov.net/stay safe for more information. Share this with a neighbor, and let's come together as a community and keep fighting to get through this. Together, we will come back stronger. God bless.
If the COVID-19 coronavirus affects one of us, it affects all of us.
It does not discriminate based on race or ethnicity.
We are in this together, and when we work together, we are stronger as a community. Each person that has accurate and timely information about COVID-19 not only helps him or herself, but it's helping the entire county.
That's why Hillsborough County needs your input in the anonymous Stay Safe survey. Your feedback will help Hillsborough County provide you and your loved ones with necessary information and resources to get through this COVID-19 pandemic together.
It takes just a few minutes. I've taken the survey, and now I challenge you to be a community player. Text Stay Safe to 73224 or visit hcflgov.net/stay safe input to take the survey.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/stay-safe for up-to-date information and tips.
So due to our closures of all of our congregate dining centers and senior centers because of the COVID-19 pandemic, we have 26 different locations that we're still providing meal services for, although today is one of our 10 grab-and-go locations. The grab-and-go locations were established at the locations where seniors live in our senior high-rises, senior apartment complexes, and for that we work with our food vendor and we're able to literally bring frozen meals to our seniors, and then we're delivering 14 frozen meals to our seniors every other week, so we make sure that they continue to receive the nutritional meal that they would have if they were still attending one of our congregate dining centers. The meal
Good afternoon. I'd like to call the Emergency Policy Group meeting to order. Hope everyone's doing well. I missed you. Glad we were able to get back together. Will the clerk please call the roll?
Good afternoon, Miller.
Here.
Overman. Overman. Merman.
Here.
Cronister.
Lazinski here for Cronister.
Castor.
Here.
Ross.
Here.
Lott.
Here.
Snively.
Here.
And Mr. Merrill.
I'm here.
Okay.
Thank you. You have a quorum.
Thank you very much. We're now moving to the public comments section. We have 20 minutes allotted for public comment. Each speaker will have 2 minutes to speak. We have 4 speakers today. The first speaker is Ramona Mueller.
Hi there, this is Ramona Mueller, and I wanted to speak about children and our playgrounds, pools, and splash pads. I wanted to talk about, since children seem to be the least affected by COVID-19, I'd like to urge the Commission to reopen playgrounds, splash pads, and pools for children's activities. My children participate in the swim team at a local city pool. And I called this last week, and they said they're waiting for the green light to do more than lap swimming. Parents should be able to assess the risk and evaluate for themselves how many kids are at the playgrounds, or if they want their children involved in extracurricular activities, and can determine the acceptable risk for their family. And now that we've reopened summer camp and children are socializing through that, I'd like to urge you guys to consider allowing other normal child activities as well. And if not now, can you discuss what you're waiting for?
Okay, thank you very much, ma'am. Chris Ann Hall.
Hi, this is Chris Ann Hall. It was recently published in the Tampa Bay Times that Mayor Castor will be requesting more votes for the city of Tampa on the EPG than those in all of the county. Article 4, Section 4 of the U.S. Constitution guarantees that every state in the Union must be a republic. In 1845, Florida adopted the first constitution, making Florida a constitutional republic. In a republic, laws are made through equal representation, not through the will of the most populous. The reason Florida is a constitutional republic is for the sole purpose to guard the rights of the individuals and minorities over the will and whim of the majority. It is only in a republic that a minority can have a society-changing voice. In a government where power comes from the most populous, the life, liberty, and property of the minorities are always in jeopardy. This is not speculation, this is history. So as you consider Mayor Castor's demand for unequal representation for the city of Tampa over the people of Hillsborough, please remember that we are a constitutional republic for the sole purpose that minorities have equal representation to the majority of the population. It has been the truth throughout all of history that when a large group has control the rest of the population, slavery in one form or the other is always the result. Thank you very much.
Jeffrey Puglisi.
Hi, good afternoon, council group. My name is Jeffrey Puglisi, and I wanted to express my non-support for contact tracing, and I'd also like to hear where you all are at with that. I don't agree with infringing on our Fourth and Fifth Amendment rights and privacy of and being secure in our homes when they're using our cell phone data. They're selling our cell phone data, our private information, our health records, health information, and using infrared technology to spy on us in our own homes. I don't agree with making policy, a group of individuals making policy, subverting the legislative process, separation of powers. I don't agree with that at all. It's an old trick, and it goes way back. There's nothing new, and it stinks. If you all would just concentrate on fixing our roads, fixing our stormwater, making sure that these things are taken care of, our fire, our police, our sheriffs. If you'll not let criminals out of jail, I would appreciate that very much. And I listened to what you have to say about where you're at with contract tracing. And again, thank you all for your service.
David Baumgartner.
Hi, yes, thank you for the time. My name is David Baumgartner. I am calling today to ask that you reopen parks and recreational facilities to allow our children to get back to some form of normalcy through sports and outside activities. As a coach and parent, I can assure you we will do everything asked of us and everything in our power to keep our children safe as they get back to playing and getting outside. All we need now is your vote on this issue. I ask that you follow the governor's executive order from last week and allow our children to get back out and play. I thank you for the time.
That was our last speaker, and that closes public comment. We now move to emergency management update. Mr. Dudley.
Good afternoon. We continue to support in-home testing and operations at our remote collection sites, Raymond James, Lee Davis, South Shore, and Plant City. Total supplies on hand, 6,886 kits. And we've gone over 20,620 outstanding job by the teams on the ground. Testing conducted this week by close of business yesterday, 934 collections. We have 1,150 appointments scheduled for the remainder of the week. We have 539 appointments scheduled for next week. We continue to take appointments throughout the day and through tomorrow. And you can contact the call center, 272-5900, from 8 to 5 to schedule appointments for our collection sites and our mobile teams. They've been doing an outstanding job making those home visits. We've had an increase in distribution of PPE. We continue to support critical facilities and their requests. So we do not have any unmet needs with any of our healthcare facilities. There's been no change in donations. We still encourage folks to, if they want to donate, we're still at 250 West Shore Plaza on Tuesdays and Thursdays, 9 a.m. to 3 p.m. We have the quarantine site, 2 guests at the quarantine site and 18 guests at the isolation site. We continue to support the Department of Health with long-term care facility testing. This concludes my update. Any questions?
Thank you, Mr. Dudley, and I see no questions. Thank you very much for your report. Public health update, Dr. Holt.
Excuse me,
Yes,
Chair
sir.
Miller. I'm sorry, I had my hand up. I'm sorry.
Okay, I'm sorry. Ms. Snively, you recognize.
Thank you. I just wanted to follow up with Mr. Dudley to see if he explored the potential for putting a location in the Brandon area. I recommended a location to investigate that last week. I just wanted to see if there was any update on that.
Ms. Snively, I think that's on the agenda coming up. Additional testing sites. Mr. Early is going to talk about that.
That is correct.
Okay, sorry about that. I thought that fell under Mr. Dudley. Sorry. Thank
Mr. Early is
you.
going to talk about that. You're welcome. So another hand. Mayor Castro, you recognize.
Thank you, Chair. I just wanted to hear about those mobile visits. Are those mostly citizens in the community, or is that being utilized for the nursing homes as well? And I'm not sure if Mr. Dudley has the answer to that.
We do testing with citizens, and we have some smaller nursing homes with a small population. We have also used them as a resource as well. So this effort has been in addition to what the state has scheduled for the larger facilities.
Okay, thank you.
Thank you.
Okay, I see no more hands at this time. Mr. Dudley, thank you very much. Dr. Holt.
Yes, sir. This is Dr. Holt, Florida Department of Health, Hillsborough County. Today, we'll begin with the review of our EPI information, trends, and takeaways that have happened over the past week. And Mr. Wagner will then provide a full graphic presentation. As requested, Dr. Emmanuel is invited back to discuss COVID-19 in children and some reports of Kawasaki diseases and things in the community. And I've also invited Mr. Gordon Gillette, the CEO of the Early Childhood Learning Center here in in Hillsborough County, and Angela Chowning, of the Hillsborough County Child Care Licensing to provide an update on work and efforts regarding child care facilities. I'll begin with the epidemiology overview. Total cases as of this morning was 2,017. That's an increase of 250 from my presentation a week ago, or an average of about 35 a day. We've now tested almost 4% of the population. 419 of our cases are associated with long-term care facility. We've had 76 deaths. That's an increase of 11 from my past presentation a week ago. All of these deaths have again occurred in everyone except for one over the age of 55. And 46 of these are associated with long-term care facility residents. The number of patients with COVID-19 in the hospital is 172. That's an increase from 24 from a week ago. Looking at our 14-day trajectory, you'll see a notable increase compared to what we presented last week. This has certainly gotten my attention and some concerns. While it is clearly directly related to the number of tests that are being done, which has increased significantly, I really want to begin to see this flatten or even ideally decrease as we continue to increase our testing. The 14-day positivity remains flat to slightly decreased, again, suggesting that of the testing that we're sampling, the percentage of cases we're finding is the same. It's just the absolute number of cases is going up as we do more testing. Our rolling 14-day average, looking at our deaths, continues to trend downward, and our syndromic surveillance has not been updated as of this time. So my summary is that if you look at our aggregate profiles of what we're looking, there's some mixed information here. We have seen, as I mentioned, an increase in cases over the last week, particularly, that is, again, associated with our testing. The positivity rate remains flat. Our hospitals and ICUs are not stressed, and our death trends are downward. So I guess the message is continuing to be that COVID-19 is still circulating. At least 97% of our population is susceptible. So using the analogy of our wildfire, while it's not out of control, it is partially contained. We need to double down on our recommendation to continue to be very situationally aware of your personal space, protect it, know who's in your circle, mask, do your part. If you are infected but still feel well, mask will reduce the amount of viruses that you will spread to others. Hand washing, sanitizing, and again, social distancing as we go out. Again, make good choices, going out to eat, best to be outside or places that have tables separated. As we enter into this, and one of the citizens talked about our contact tracing efforts, I want to reiterate, we are not using any cell phone data that is that an individual does not allow us to do, and that's only to prompt them to remember where they have been, not to use it to contact anyone else. But as people have started to go out, we are identifying more people that they have been around, and so our investigations continue to take a little longer. The good news is that 60% of the cases or the contacts that we identify from the case have agreed to use an automatic, their choice, being notified through a text, which comes daily, which asks them how they're doing, how they're physically doing, how their health, and also are they responding or are they compliant with our isolation. So that certainly has helped in the efficiency of the process. We are currently augmenting our staff. We had 9 full-time. We have 19 that have health department employees that have been reassigned. The state has provided an additional 3 positions. By Florida statute, the Florida Department of Health is the only authorized entity to do contact tracing to allow access to the restricted statewide electronic database. We were informed that the state has entered into a contract that will provide additional paid tracers that will be deployed statewide. I think this is very timely, and we certainly expect to see over our next few months our College of Public Health volunteers who have been doing a great job will eventually start returning to class. My final comment, again, going back as Mr. Dudley alluded to about the long-term care facility testing, there's a goal to have everyone tested, all staff and any resident that wants to. By June 1st, we have already completed 45% in our county. We have 35% already scheduled, and we are committed to completing the job. I will stop there and ask Kevin if he would present his presentation.
Dr. Holt, before Mr. Wagner starts his presentation, I see some hands up. I think some questions for you. Sure. If you don't mind. The first question is from Commissioner Merman. You recognize.
Thank you, Mr. Chair. Dr. Holt, I have noticed that the numbers are increasing. Do you have a certain point in your mind where you will consider it that we need to take the increasing numbers very seriously and maybe make some additional recommendations to the community?
Yes, ma'am. I think you have to look at the entire the full picture of all of the combined metrics that we're looking at. So the first one we talked about, which is the 14-day average. This sustained increase, certainly continue if it continues, and in the face of flat or non-increasing testing, would trigger my concerns. Is there an exact number? I can't. I certainly don't have that exact trigger. It is just something that we all need to consider in how we collectively and as elected officials take the actions we feel appropriate.
Thank you very much, and thank you all every week for your report. I guess, have you seen any other counties seeing their rates go up similar to ours?
Yeah, that's a great question, and we have. I think, again, working closely with my regional people in particular, which I think have the greatest impact. And I think right now things are very fluid. I think in this next 1 to 2 weeks, I think we'll sort of get to see the trend and the pictures that we can use that would provide some reasonable basis for actions if necessary. I'll stop there.
Thank you very much. And I am concerned because I do believe our community has really opened up their activity level, and I don't see a lot of safe distancing or mask as much as I would like. So I hope we keep a handle on this, and if we need to reconvene as an emergency policy group to address the increase, Mr. Chair, I'd love the fact that you will be able to do that. Thank you.
Yes, ma'am, I will do. I have a question for Dr. Holt, but I'm gonna wait till the others ask their questions. Mayor Ross, you recognize.
Thank you, Mr. Chair. Dr. Holt, thank you for the presentation and all the work that you're doing. 250 new cases in a week does seem like quite a bit. I have a twofold question about that. One is, are all of these people, or the vast majority of them, are they symptomatic? Are these people sick, or have we started to find these asymptomatic people that don't know they have the virus? That's the first part. The second part of the question is, through your contact tracing, have you been able to determine any patterns of how these people contracted the virus? Are they, we're trying to assess how dangerous it is to be out in the community. Are they catching this from going out and grocery shopping or going to parks, or are they catching this from family members, or have you been able to determine any patterns about how they might be contracting this?
Yes, sir. Excellent questions. In the first one, which is the asymptomatic question, and the percentages as I've mentioned before, I would say continue to be in that 20%, 10 to 20% range. It so much depends on why the individual chose to be tested. The predominant amount of people being tested are still have some concerns that they they're not feeling well. But there's another group that clearly feels they believe they were exposed. And so those are the ones we do pick up some reports of didn't realize that they were ill, but they reported or they knew somebody around them that either had it or believed they were around someone. So that has been kind of useful. As for the contact tracing, we have not at this time identified a specific connection between cases outside of individual families or the people that they kind of know. Those that know have a suspicion of where or who the circumstances they got it in. And because of the restrictions on the social distancing over time, at the time that the cases are reported, they weren't going around a lot. So I think, as Commissioner Merman mentioned and so others, I think over this next week or so, that is exactly what we're really paying attention to, because now people are out and about, and we will hopefully be able to see and detect any patterns that suggest there's a correlation between being out versus still the majority of the cases historically are in your close, those that you know and spend a lot of time with. I'll stop there.
Well, thank you, Doctor. I think, and I know this is a difficult question for you, but I think that's key for us as a policy group, because this data is essential. If we can determine how people are contracting this, we can make measures that are surgical and make, it doesn't do any good to close, I don't know, boat ramps or whatever, if that's not where they're getting it. If we can figure out how people are transmitting it, that might help us to know how to surgically respond to that. Thank you, Doctor.
Commissioner Overman, you recognize.
Chair, and just for the clerk's knowledge, I actually did hear the public comment. I entered the meeting late, and I apologize for that. Dr. Holt, thank you for your report. One of the things that I've noticed in a couple of other areas over in Pinellas, and then I took a look at a report from the State of the Region recently, and they were reporting the hospital capacity. So, one of the reasons we are concerned about spread is to make sure we don't overrun our hospitals. I'm not seeing that in the data that we're receiving on a weekly basis, but based on a report I did see from the State of the Region, it appears as though our hospital capacity on a regional level has fallen below 25%. And I'm not getting that data here. If you have that data, is that what your observation has been for Hillsborough County? Because that's a key issue in being prepared for continued community spread. And I'll stop there.
Yes, ma'am, you're absolutely correct. That is a traditional, and it's one that been so low during the prior to the closure of the elective procedures, and even the public in general was avoiding hospitals. So you're correct. It's in the 20, 30-ish percentile and has been that way throughout this whole period. So I have chosen to follow, or at least the direct demand of COVID on our hospitals, which is the number of beds and ventilators in particular, which I did not report but hasn't changed. The majority of our patients in our hospitals, I think I've alluded to in the last several weeks, are those that have been proactively transferred from the nursing homes or long-term care facilities, and many of them are not in the ICUs. They're in a general ward. So, but you're absolutely correct. As we move into this different phase, that's while the hospitals are operating normally, that metric will become a common part of our presentations.
Excellent. Thank you very much.
Dr. Holt, let me ask you a question, sir. I know you said that when Commissioner Merman asked about what would the number be that would trigger us looking at putting in more probably restrictive measures because of the mere fact we're seeing an uptick in Hillsborough County. Over the last 14 days, there's been an uptick in the state of Florida also. So would the CDC or would the Florida Health Department have a number that they may look at saying this is what we need to look at all before we start adding more stringent criteria? Would they have those numbers?
I think you're correct. I don't think they have numbers, but the guidance and the direction that I certainly will convey is going to be collected or conveyed by the Florida Department of Health, and it is among the state epidemiologists and the leaders is an active discussion about just how to quantify what is that trigger. And so that's why I'm unable to really say what my specific number is, even if I have an opinion, but I am part of that deliberation throughout the state, as all my colleagues are.
Yeah, I know you're still on top of it, sir. Yeah. Commissioner Overman, do you have another question?
No, I'm sorry. I forgot to take my hand down. I apologize.
Okay, thank you. Mr. Wagner.
Mr. Chairman, do you see my presentation, sir?
Yes, sir. Yes, we do.
Great, thank you. Again, Kevin Wagner, Business Analyst for the Healthcare Services Department in Hillsborough County. Before I jump into the epidemiology, we always like to present weekly the testing that we have received and information from the providers and or the testing that's been done at Raymond James and the community resource centers and mobile. Excuse me. I'll speak to the graph at the bottom. For the week of May 17th to May 23rd, from the providers and the CRCs, there were 650 tests initiated for that week. Of that number, 74% or 11,646 were done by providers. Our providers in this sample include Advent Health, Daycare, Family Health, HCA, Tampa General, and Suncoast. And then the Raymond James, CRCs, and the mobile unit did another 4,000 tests in that week for about 26%. So those two pictures combined show that there were 15,000 tests given in the week of May 17th to May 23rd. Again, you've heard this, the county profile as of 5/28 today. There were 2,019 cases. Of that, 1,960 were Florida residents. The remaining 59 were non-Florida residents who tested positive in Hillsborough County. Our percentage of the demographics are 53% for women, about 1,042, and 47%, little over 900, are in men of the positive cases of the Hillsborough County residents. Again, looking at the demographics, we show this every week. This is still a standard bell curve of the number of cases by age grouping. Again, from the 20 ages of 65 plus, nearly 25% are positive. Nearly 73 to 75% are within the working age ranges of 15 to 64, and the remaining percentages of 3% fall under the age of 14. But again, this is the standard bell curve where this disease, this virus affects everyone at all age groups. The next 3 slides accompany very much what Dr. Holt was talking about. What we see on this first one is the rolling 14-day average of new cases, which had various discussion earlier. Again, on 5/2 to 5/15 on the far left-hand side, there was an average of 28.6 new cases a day, and we've seen a slightly upward trend to 34.5, and that was as of 5/28. So again, that is one component of the equation that I always look at from a holistic viewpoint, the number of new cases in a day. The other part of the equation is the number of test results that are being received from the Florida Department of Health on a daily standpoint. The rolling average on test results around 5/14 on the far left-hand side was about 1,000. So again, at that time, we were getting a little over 1,000 test results daily. As of 5/27, 5/28, we're getting about 1,500 test results a day. So there's been an increase in test results, which is again contributing to the increase in positives. So again, that's the other part of the equation. We are still slightly below the projected need to test 2,250. Again, testing by USF, that's 2,250. And we do see variability in the test results. So we do see that trending higher. And again, that's the direction that we want to see on the test results. The third part of the equation, where we talk about the number of cases, we've talked about the number of test results, is the positivity rate. So this one is slightly downward or flattening, where on 5/15 on the far left-hand side, there was 2.91% positivity rate of the rolling 14-day average. Every 14 days, it was about 2.9% positive of the test results. As we roll over to 5/28, it's 2.45%. So again, that is trending downward. So again, when I look at the equation, there's always the 3 components from a holistic standpoint: the number of cases, the number of tests, and the positivity rate. Again, with the downward trajectory, this is as of 5/27. This was essentially the same report that we provided last week. I will update it for the following week. The downward death trajectory is showing a downward progression. Likeness of COVID illness presenting in the ED. This again is updated weekly as Dr. Holt shown. But again, this is showing a downward progression on a 7-day rolling average of about 157 as of 5/17. As when this gets updated, we will update accordingly. But the trend of presenting in the ED visits with COVID-like illness is going downward, or is projected to be going downward trend. Testing on the total population, again, we're almost at 4% now. Currently, we're at 3.73% when we look at the total tests administered to the population total. So again, this number, as we've been showing, started at 1%. Now we're at 3.73%. And I'll stop there.
Okay, Mr. Wagner. I see no questions, sir. Thank you very much.
Thank you.
Dr. Holt?
I'm sorry, Mr. Chairman.
Sorry?
I'd like to invite Dr. Patty Emmanuel.
Dr. Holt, hold on a second. I didn't see Mayor Lott's hand. Mayor Lott, you recognize.
Thank you. So just to be clear here, so I am making sure I'm on the same page with everyone on the board here. So when the numbers obviously show that, and I think we knew this when we increased the testing, that as we test more, the number of cases obviously goes up, okay? So the most important number is the percentage. It's the percentage of positive cases going up or the percentage of positive cases going down. And because if we went from 2,000 tests a day to 4,000 tests a day, you would obviously assume that the number of positive cases would go from 35 to 70. And it went from 4,000 to 8,000, 70 to 140, roughly in those numbers there. So to me, the most important number, far as in positive cases, is the percentage of positive cases versus the actual numbers. Am I correct there?
This is Dr. Holt. Yeah, I would concur with that, is that the positivity rate does show typically within the community what is the, at least of those you're testing, have virus. And so, yes, if you start testing more, as long as the positivity doesn't go up or something, or change significantly, you're just going to continue to see a linear direct association. I'll stop there.
Okay, thank you. I just want to make sure that was the equation that is most important, is that percentage of population that's positive, not the actual total number. Because obviously, if we, tested 10,000 people a day at 2.4%, then obviously there would be, 240 people a day become back positive. And so, which would be alarming, but if it's at 2.4%, I think it's in the projection range where we're at. And so I just want to make sure I was looking at it the way you're looking at it. So thank you very much.
Thank you. Dr. Holt?
Yes, I'd like to invite Dr. Patty Emmanuel. She's spoken to us before. She's the chair of the Department of Pediatrics at USF College of Medicine. Dr. Emmanuel, are you available?
Yes, I'm going to share my screen. Can you let me know if you see it? Got it?
Yes, Dr. Emmanuel, okay. Welcome.
Great, thanks. So thank you for having me. I was asked to come back to just give an update on what we're learning about COVID in children, and also to comment on the child care issues. So what we do know is we continue to see that children account for less than 2% of all the COVID cases and have a lower overall hospitalization. They tend to have milder respiratory illnesses. And we are learning some information that they express some of the receptors in a smaller amount, and that may be why they are both potentially getting less infection and certainly getting less symptomatic. However, we do know that there are a number that children are getting COVID. We see it in all ages, including the newborn period. And we have started to see the pediatric multisystem inflammatory syndrome that you've heard a lot about in the news in the last couple of weeks. This is, I will make sure folks know it's rare. It is most likely a post-infectious process where children present with rashes, fevers, shock, and it can be quite serious. There have been a handful of cases in our region, and it is now a reportable disease at the state level. So they are monitoring that. There is some new information that's come out in the pediatric journals the last 2 weeks about children's role in transmission. They do not seem to be significant kind of drivers of the epidemic as you normally see in things like influenza. And they are rarely the index case. So most children are primarily infected via their own family members. And that, again, it's only 3 or 4 studies, but that is what the data seems to show. As we've mentioned, and as you've also seen in Hillsborough County in the state of Florida, children are not being tested at the level compared to adults. If you look at this, it's the orange and gray bar. This is national data from the American Academy of Pediatrics. So we're not really testing children, so it's difficult to know the full spectrum of the infection. And again, they represent less than 2% of all cases, but we are starting to see more cases. I was asked to comment on the child care, and there are a number of, there's guidance from the CDC, from the American Academy of Pediatrics, from the Florida Department of Children's and Families, which goes over the major areas: social distancing, disinfecting, hand washing, modifying drop-off and pickup procedures. So there is a number of guidelines that have been written and that are available for childcare providers to start to be implementing their own plan and policies, and every child care center should have a policy. The Department of Children and Families recently, this was their guidance dated April 21st, which recommended maintaining a staff to child ratio less than 10. And in May of 26, so just this week, they lifted they provided some increased guidance and lifted the limitation on group sizes, with the caveat that the CDC does recommend that group sizes remain small and that there be no mixing of one group with another group. So this is the current guidance from Florida Children and Families. I found this from the Cleveland Clinic, their healthcare guidelines, and I really think this is a wonderful visual for us to look at what we're trying to achieve with the various recommendations that we're giving to schools and parks and daycares. And for those of you in healthcare, we always talk about the Swiss cheese model, which is, layering, just layering safety procedures so that it's not dependent on any one person making a mistake. And so they use the Swiss cheese model to talk about, should we have adults wear masks? Well, it's not 100%, but it does help decrease transmission, particularly if you're asymptomatic and infected. What about social distancing? Same thing. Can't always achieve it, but it does make a difference. The disinfecting, the hand washing. So I think this is when we are talking to our childcare providers, our schools, I think understanding that we have to layer levels of protection, because we're not going to be able to achieve perfection in any of these areas. So my last two comments are about masks, related to childcare. The American Academy of Pediatrics has come out and said that masks can be worn for children above 2 to 3 years of age. We want to be careful at the under 2 to 3 because of the risk of suffocation. There also is evidence that there's less transmission kind of outside playing. So it may be that there's times where mask will be more important than other times. And adult providers should wear masks, not probably, should wear masks in these settings. And then a note about social distancing, and this is my own opinion, I'm going to say, the numbers are kind of all over the place in terms of the number of children per, the ratio of child to a provider. But it is important that we try to keep the size as small as possible, that we attempt to maintain social distancing in the classroom when we can, that we are implementing enhanced hand washing and cleaning and screening and all those other things. And as child care centers open, I would certainly recommend that we consider a more gradual increase in numbers to allow the child care providers to implement these new procedures. We had a discussion yesterday, and I was saying that that's the way we've been doing it in our clinics, where we're gradually increasing the number of patients we see every day. And it is a hardship, but it has allowed us to get better and better with those procedures as we move forward. Because I do think we all have realized that this is going to be a more long-term issue that we're going to have to work with. So I'll stop there, and thank you for your time.
Thank you, Dr. Emmanuel. I see a hand up for a question. Commissioner Overman, you recognize.
I can.
Thank you. I'd like to actually wait until Mr. Gillette actually does his presentation for my question, but it does relate to both their topics, so thank you.
Okay, all right, good. Dr. Holt, you want to bring on Mr. Gillette?
Yes, if I may, I'd like to ask Mr. Gillette and Ms. Chowning if they are both on and would address the group.
Yes, sir. Mr. Gillette, you recognize.
Thank you, Dr. Holt. Thank you, Mr. Chair and EPG policy group members. And Angela and I think we'll kind of tag team on this a little bit, but just want to let you know the Early Learning Coalition, which I'm the CEO of, is the nonprofit that that's overseen by the Florida Office of Early Learning in Hillsborough County. And the Office of Early Learning reports to the Department of Education and the governor. We're the funding agency for two important early learning related programs, the School Readiness Program, which provides subsidized childcare for low-income families and at-risk children, and the Voluntary Pre-Kindergarten Program, which 75% of all 4-year-olds attend. We contract at the Early Learning Coalition with over 1,000 childcare centers and homes across our community, and we work regularly with Hillsborough County Childcare Licensing, which has delegated authority from the Department of Children and Families in licensing. At the Early Learning Coalition, we're working with the Office of Early Learning at the state level to administer $233 million of funding that came to the state of Florida through the CARES legislation. And we're providing special funding for healthcare and first responders, healthcare workers and first responders, providing them with 3 months of subsidized childcare. We're also providing grants to childcare programs for supplies, infrastructures, and professional development. Just a little bit of feel for the kind of scope of the numbers that we think about in Hillsborough. We're contracted with 881 providers for the School Readiness Program. 202 of those providers are either school district or YMCA site after school programs. So when you take that out of that number, there are 679 child care centers and family homes contracted with us that are providing school readiness services. At the peak of the shutdown of childcare during March and April, 312 of those centers and homes were closed, or 45%. And what we found was, in those that remained open, there were about 3,000 open slots, even with the group size less than 10 restrictions, open for first responders and healthcare workers, children. That number that has, the number that are closed at this point is reduced from the peak of 312 to 128 last week, all the way to 56 this week. So at this point, we only have 8% of the centers and homes that offer the school readiness services closed. And we estimate from a survey that we do every week that there are 5,000 slots open for childcare. And so I think the conclusion here is that parents and families are still keeping their kids home for the most part, and the supply of childcare is exceeding demand at this point, even with the old group size less than 10 restrictions. But I think the other conclusion is that we're seeing a rapid return of these businesses that were closed to being open. And I think over time, we'll see a general increase. And so mating some of my comments perhaps with Dr. Emmanuel's comments, I would say that we're seeing a gradual increase in centers being open. We think that'll be followed by a gradual increase in attendance at those centers. And therefore, that gradual increase that Dr. Emmanuel recommended probably is going to happen naturally, with the important guidance that she provided that in addition, group sizes should be kept even with no mixing of groups during the day. And that concludes what I wanted to say. Angela, you want to say anything?
Hi there. Good afternoon to everybody. I'm Angela Chowning, the manager of child care licensing. And our role in terms of child care in general is to provide health and safety inspections to those programs, and that's countywide, regardless of whether they accept school readiness dollars or voluntary pre-K dollars or any of those things. Our role during this particular time of the pandemic was not to enforce the governor's orders, but simply just perhaps put the information out to childcare providers. And I know that right now we're working on some more messaging to the childcare providers to make sure that they are clear on everything that they should continue really to do. These are all recommendations. That's the hard part of it. When the governor lifted the size restriction, obviously most of the providers were happy about that because they assume that as parents go back to work, they're going to need that space. So right now, again, we're just continuing to work together to work on some messaging. And I'll stop there.
Okay, Mr. Gillette, Ms. Chowning, thank you very much. I see Commissioner Overman has a question. Commissioner Overman, you recognize.
Thank you, Chair, and thank you all of you for bringing good information for us to help us understand, because as I mentioned last meeting, that childcare is the beginning of our quote unquote food chain for opening up our economy, and it's very important. I actually have 3 questions, and then I'd like to suggest something. Question for Kevin Wagner. Of the 76% of the workforce that were tested, what percentage of those that were tested positive actually have children, and were they tested? Because that's an important piece of this equation when we talk about childcare.
So that 76%, that was the population that was tested positive, or that is tested positive. Right. That breakdown, if they had children or not, isn't available in the line item of the FDOH data, Commissioner.
Okay, so is it our practice that any workforce age person who has children, those children get tested?
Those were all the results of individuals choosing to get tested or testing at the long-term care facilities from those test results.
Okay, all right. So I guess that's a question for Dr. Holt, or we'll address that later, because what Dr. Emmanuel said was that we don't have very many children tested.
If I can just jump in for a second. So the testing is voluntary, and we don't compel anybody to test anybody in their family because it is voluntary. So if someone calls the call center and says, I want to be tested, they can ask to also test the child or another family member, but we can't compel them to allow us to test their children. And while it might be a good idea, that's not something we can mandate.
Okay, well, thank you. And given that we haven't had a great deal of demand up until this point, because the schools have been closed, and we haven't really had a lot of people going back to work, and the need has not been there as reflected by Mr. Gillette. I think it's important for us to recognize that when these kids get together and they may have been exposed, they're together. And so it's important to take a look at the recommendations that have been made. Dr. Emmanuel, the question I have for you, when the DCF came out with a recommendation, and our childcare licensing has guidelines on the number of providers per child, is it correct that the American Academy of Pediatrics suggests a ratio of 12 to 1 for older children, or the 10 number or the 10 or around that range would be prudent for any facility opening up at this point as a first phase of opening?
Thank you for that question. I think that I was researching ratios this morning. It hasn't been something I've really looked into before. And the American Academy, they have a early childhood group, they do recommend lower, like 12-to-1 ratios. And I think where that gets complicated is that many classrooms might have 25 children, but they have two providers. So that's and in this scenario, you would split those and you would have one provider per 12. So I do think it's prudent that the group look at sizes and because, and my second part of that is that in order to do all the other recommended things, guidance, including more hand washing, more cleaning, the social distancing, 6 feet, I'm not sure how you can do that with the numbers that are that are approved, the licensing. I don't know how you take 25 5-year-olds and get them to wash their hands with one person. It would be a challenge. So that would be something I think should be considered. Yes.
Thank you. And that's why I wanted all of us to talk about this, because if we go to the DCF guidelines and follow our childcare licensing, the child to provider ratio exceeds the governor's previous guidelines of 10 children. It actually does have, for example, as you mentioned, 25 children per person or per room. And that during a pandemic is probably not prudent. It also, given that we can't get adults to wear face coverings, the likelihood of having children comply with keeping them on all day long is probably very, very slim, even if we're able to distance them. So I think given that we're also seeing that parents are hesitant to send their kids because they recognize they tend to share well. So we may not have the demand we need, but we do need to set some parameters. And so I'd like to make a motion for consideration by the group. I'm willing to hear more comment after that, but I'd like to make a motion for consideration that in addition to the CDC guidelines, DCF's guidelines, and the child care licensing regulations, that child care, summer programs, and youth programs must be carried out in stable groups of 15 or fewer with an effective date on Monday, and that this order be included in the communications documents being prepared for distribution to all stakeholders. And that's, our child care providers and those that are actually dealing with children as we adjust to this time period where kids get together, because they haven't been up until this date.
There's a motion by Commissioner Overman. Is there a second? Is there a second? That's a third time. Is there a second to Commissioner Overman's motion? Motion dies for lack of a second.
Thank you, Chair.
You're welcome. I don't see any other hands at this point. So, Dr. Holt, is there anything further you want to bring forth? I'm sorry, Commissioner Merman, you recognize. Commissioner Merman, you recognize. Commissioner Merman, you recognize.
Okay, there I am. I appreciate what Commissioner Overman is trying to do. And really, thank you, Dr. Emmanuel. Thank you, Gordon Gillette, for your reports, your recommendations, everything. I think the more appropriate, maybe an appropriate motion right now would be to take Dr. Emmanuel's recommendations and Mr. Gillette's recommendations and of course, Ms. Chowning's with our childcare licensing, and give them the responsibility to review these recommendations on a weekly basis and communicate that to the providers And of course, our communications department can assist in that. I think that what I'd like to do is I'll make that as a motion to take their recommendations and give the full responsibility to child care licensing and Gordon Gillette with the Early Learning Coalition to communicate with providers on all those safety things that Dr. Emmanuel recommended. I mean, that is so important. That will prevent the virus from spreading. The minute these children walk in the door, I know they're taking their temperatures right now. They do a Primrose. They make them wash their hands the minute they walk in the door. They go in the classroom. They have to wash their hands after every single activity. So I do think that there is a lot of good things happening, but we need consistency. And I think giving them the responsibility is the right thing to do right now to make sure that they're adhering. And then if they think the groups are too big, then they can come back to us and they can say, we need to do something. So I guess that would be my motion, to take the recommendations that have been given to us and give the responsibilities to Child Care Licensing, Early Learning Coalition, to communicate those to the child care centers, and of course with help from our communications department and the joint committee, communications committee if necessary. That's my motion.
I'll second that.
Okay, we have a motion by Commissioner Merman, second by Commissioner Overman and Ms. Snively. Ms. Snively, you recognize.
Thank you, Chair. And I appreciate all the information that's been given to us today. So thank you to our team for the information. And I also appreciate what Commissioner Overman is trying to accomplish. But I do agree with Commissioner Merman. I think that there's already enough regulation happening with the current agencies. And I don't necessarily think that we as a policy group need to, mandate any additional regulations. And I also think that there's, a responsibility of those child care facilities to make sure that they are adhering to the recommendations. But also, I believe that parents can make that decision as well when they decide to choose a child care facility. Those are the questions that they're going to ask the facility, what practices they're using. They'll do their due diligence as parents to investigate and inspect the child care facilities to make sure that they are being prudent with the recommendations, because obviously parents care about their children and they're going to want to make sure that those child care facilities are doing their best to prevent the spread of the virus. So I think the responsibility does lay in the hands of those child care facilities, as well as the parents and guardians of the children who are enrolling in those child care facilities. And I would concur and agree with Commissioner Merman that communication and education are key, and that those have to be regularly communicated, those recommendations regularly communicated. And I think that in itself is adequate in trying to further spread the virus. Thank you.
Thank you. Mayor Ross, you recognize.
Thank you, Commissioner. I have a question. I think it's best directed at Mrs. Chowning. And forgive me if I'm maybe not up to speed on all the child care licensing issues. It's a little out of my lane. But if I understand the motion correctly, we're asking them collectively to communicate with the child daycare centers. And I guess my confusion, or maybe I don't understand correctly, but Mrs. Chowning, I thought that's what you did. Aren't we already communicating practices to the daycare? Is this something new or additional? I thought this was already going on.
It is. Thank you for that. It is. We communicate very regularly with the child care providers via email and also during our visits, as we're going out to do the inspections. So I think because the information is so fluid, it's not a bad idea to put out something in writing on a weekly basis or at least very routinely, but we are doing that already.
Okay, thank you.
Mayor Lott, you recognize.
Thank you, Mr. Chair. So earlier in our meetings, I don't know, about a month or so ago, we took on a motion without having it in writing so we could actually see what the motion, and what the fine details were of the motion was. And then we came back and, there was a lot of conflict and it caused a lot of confusion in our community and so forth. And so if you would please state exactly what this motion is. Is this a recommendation, a mandate? Is it new mandates? Is it new recommendations? Is it just more strongly recommending what we're already recommending to our child care facilities? I just want to be crystal clear on exactly what we're voting on, please.
Commissioner Merman, you recognize.
Thank you, Mayor Lott, for that. Actually, my motion was to take the recommendations from Dr. Emmanuel and Gordon Gillette from Early Learning Coalition and give the responsibility for communicating those recommendations that they made to Angela Chowning, our Child Care Licensing Director, and Gordon Gillette, the CEO of Early Learning Coalition, to communicate that to the child care centers with the help, if they need it, from our Joint Information Committee and our communications department at the county. It was basically taking what she said today in her recommendations and what Early Learning said.
So my question is, and I'm not up to speed on all the rules and regulations, I apologize, but are the recommendations that were made today, are those new recommendations that they're currently not in place? Are these recommendations? I want to make sure it's a recommendation, not a mandate.
No, they're the standard.
What's already being communicated, we're just going to communicate better. So this motion is to communicate better the current recommendations that they already have. We're just going to communicate it to them more thoroughly. Is that true?
Well, and also it's coming from the USF Department of Pediatrics. So, you're adding that credibility of the recommendation to.
But there's no new requirements being made that is mandated.
No. And that's why I think we should just give that responsibility to the two people that deal with the child care centers the most and allow them to communicate and then report back to our group every week on, things that are happening in the child care centers.
Fair enough. Thank you.
Commissioner Overman, you recognize.
I just want to help with some of Mayor Lott's confusion because I understand where you're coming from. I actually was in that meeting yesterday with all the parties we just described as being part of our deciders on how we work with our child care providers. And there was basically general consensus that 25 was too much. 10 was what the governor had said, and somewhere in that range is reasonable. The key here that in the discussion we had yesterday was that child care providers need to know exactly what they need to do in order to follow the rules. And the reason I was recommending the number previously was to address that issue. So while I'll support the motion, the issue is we're abdicating it to the folks that are in the business, which is fine, but it doesn't make it clear to anyone who needs to open on Monday what they need to do without making an awful lot of phone calls. And so I would just like to find out if in that recommendation, 25 5-year-olds to one provider is anywhere in the range of the recommendations at this point. Thank you.
Is that a question you're asking someone?
I'm going to ask Ms. Chowning that question.
So,
Chowning,
hi, sorry.
Go ahead, ma'am. Go ahead.
Okay. So I think part of Dr. Emmanuel's recommendations leaves out the number. However, it does recommend that they keep the groups small, and to not allow for the intermingling of the groups. So that would be what the recommendation is, to keep the groups as small as possible.
Okay. Mayor Lott, you recognize.
Thank you. I have a question for our county attorney.
Ms. Beck?
Yes, sir. Yes.
Ms. Beck. Correct me if I'm wrong, and I probably am, but the childcare, facilities are primarily regulated by the state. Is that correct, or am I wrong?
Well, for most counties, you're absolutely correct, but there are 5 counties, including Hillsborough, where we have been delegated the ability to do childcare licensing. So in Hillsborough, the childcare licensing regulation is done by the Children's Services Department, and of course, working with DCF.
Okay, so we do work through DCF. Do we write policy that's different than DCF, or do we primarily stick with the policies of the state?
We would have to be consistent with DCF. But we can, well, actually, we may be actually in some ways more strict. I don't know if there is anybody else on the line that knows that. Actually, Angela, you probably know that. Are we always consistent with DCF?
Mr. Chairman, this is Ramin. If I may interject for a quick second.
Yes, sir. You recognize.
Thank you, sir. Mr. Chairman, although DCF has delegated authority to us in childcare licensing, we do stay consistent with messaging around childcare and all kinds of activities around it. In fact, as recently as this morning, I spoke with the regional director who reiterated that point about the department's desire for us to stay as consistent as we possibly can be with the department. Although he recognized that the state has been differential toward local governments throughout this pandemic, it is their wish and desire to see more consistency with the department.
So my question here, does this motion stand in stride with DCF, or are we putting in place confusion or restrictions that are different than DCF on a state level?
Mayor Lott, if I might add a little bit more to that. We are permitted directly by Governor DeSantis' own words to be, so the local jurisdictions may be more strict. So while I'm not saying that's what's happening here, my understanding was they were going to be consistent, but we actually could legally be more strict. I just wanted to make that clear.
Okay, thank you. Well, I guess I don't have a problem if all we're doing is saying we're going to do a better job communicating than what we're communicating now, okay? But my concern is there's a lot of difference between should and shall, and with the wording and the communication, and I would just hope that in this better communication, we're sticking to, what are truly mandates like we currently have in place, and then what are recommendations. And I hope there's no confusion there between what's a recommendation and what's a mandate. And because there's a lot of families out right now that need child care, they need help. And I'd hate for us to be so draconian in this that we, put child care services where they don't have the ability to be able to open up and be able to provide safety at the same time. I did hear from Mr. Gillette. He says right now, I guess we have 5,000 openings that aren't unattended, or available slots. I sure hope that as of today's meeting, I hope that gets out into the media somehow, because that's the opposite of what I'm hearing from the folks that are calling me. They're looking for help and they're desperate for help. And so I sure hope we get that information out to them a better way. So if all this is a communication, then I'm okay with it. But I'm just really concerned about the communication that this is a mandate, not a recommendation. So thank you very much.
Mr. Merrill, you're recognized.
Thank you, Mr. Chair. I'm glad, Mayor Lott, that you brought that up, because I think that there still is some confusion here. Because what I heard Commissioner Merman say is that this is simply going to be a recommendation and not a mandate.
Right.
And so that goes then to the further question is, are you about to vote on an executive order? Or is this just going to be EPG's recommendation that isn't going to be embodied in an order? Because I think, to your point, Mayor Lott, this starts to escalate up a chain here that begins to confuse people. Because once you start putting things in an order, then everyone starts to look at, well, how does it conflict? If it's an order, is it mandatory? I mean, frankly, part of the confusion with the governor's orders is that they're an executive order, but they really don't order much. They just kind of say, well, you ought to try this, you ought to do this. And that just adds more confusion. And if child care licensing, which is one of my departments, is going to be involved in this, I mean, they're actually an enforcement group. So they go out and enforce and inspect child care facilities. So if they're going to be the ones conveying the message, and that these facilities are used to seeing them in their role as the enforcer, as the inspector, I just don't want there to be confusion. I want Commissioner Merman to get what she wants. I just don't want it to be then confused by the form that it takes or who delivers the message. So if it's just a recommendation, I would say my suggestion is you don't put it in an order, and that maybe it's not child care licensing that delivers it. Maybe it's just our communication department. But that's just my thoughts on it.
Mayor Ross, you recognize.
Thank you, Commissioner. Well, a lot of it's been said. I certainly have no objection. I don't think anybody does to communicating more. That's fine. But I am concerned about confusion. If I own the daycare center and I'm getting guidance from DCF and I'm reading the governor's order, and now I'm getting guidance from the EPG that's a recommendation, but it goes beyond what's contained in the governor's order, and it goes beyond DCF. I don't know if I have to do that or if that's voluntary. So it does seem a little confusing to me. If we're just talking about communicating, I guess that's okay, but I don't know. It seems like we're stepping over each other a bit here.
Before I call on anyone else, let me ask Miss Beck a question. Miss Beck, all of this discussion that we're having now, was any of this addressed in the last governor's order that he put forth last Friday?
Commissioner, the order itself was very brief. It simply stated, at least with regard to childcare, that it's open. It didn't elaborate. But what was on Tuesday, DCF issued guidance that further informed the order, and it's in that email that was part of the backup for today, where DCF stated that all of the restrictions have been lifted, and those restrictions presumably are referring to the restrictions that were part of Order 2091 relating to groups of 10 and no mixing of the groups and separate rooms and so forth. So per DCF, which is an arm of the state, those restrictions are lifted.
So wait a minute. You just repeated it. The executive order did not address what we're talking about. DCF addressed it. Am I right?
Well, the executive order did refer to child care and said it's open. That's, and then DCF in their email states with regard to the order, they reference that it is, the order that lists the restrictions. That's how DCF interpreted it. So there you have it.
So my question now is, do we adhere to the governor's executive order, or do we adhere to the email from DCF?
I think that because DCF is an arm of the state that's charged with carrying out the governor's orders, it would be reasonable to follow what DCF has said in their email.
Okay. Commissioner Merman, you recognize. Commissioner Merman, you recognize.
Sorry, I was on mute. Thank you, Mr. Chair. And basically, what Gordon Gillette does at Early Learning Coalition, what Angela Chowning does with, even though it's a county department, her policies have to fall in line with the Department of Children and Families. So I just want to make sure they can't do anything outside their boundaries. This is only a recommendation that came from USF and in conversations with DCF, actually, because I think they have been consulted over time to help keep our children safe when they come in these centers. And Mayor Lott, I particularly heard from many providers in your area, many. So that's why I couldn't support the mandate, because many of your providers are private providers and they rely solely on the income coming in from kids. But given that, they still need to be safe. So this is just, it's not a mandate. There is no, this is just like any other recommendation we've made here at this emergency policy group. It doesn't go into any emergency order, nothing. It's just simply us giving a message to the people to take care of our kids, to keep them safe. Thanks.
Mayor Lott, you recognize.
So then are we assuming that then the county administrator can take this message and deliver it as he sees best from his position as county administrator?
He can, and the Early Learning Coalition can, because they're an arm of the state also. And they oversee, you got the numbers, how many providers, 881, though Angela licenses not just them, but also the private pay providers out there. So I think we're all on the same page here. And it's basically a communication tool.
Okay, we're beating this horse, resurrected it, and beating it dead again. Commissioner Overman, you recognize.
Never mind. Thank you.
Okay. We have a motion by Commissioner Merman, second by Commissioner Overman and Commissioner Ms. Snively. Seeing no further discussion, please call the roll.
Miller,
Yes.
Overman,
Yes.
Overman,
Yes.
Merman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Lott,
Yes.
Snively,
Yes.
and just to confirm, Cronister said yes.
That's Deputy Chief Lewinsky is sitting in for Sheriff Cronister. Yes, that was a yes vote.
Motion carried 8-0.
Okay, thank you. Dr. Holt, do you have anything else you need to bring before us today, sir?
No, sir. That concludes my presentation. Thank you.
Thank you very much. Update on additional testing sites. Mr. Early, Gene Early.
Good afternoon, Chairman, and members of the Emergency Policy Group. I'm Gene Early, Department of Healthcare Services. The county has been working with Brad Harriman, CEO of the Suncoast Community Health Centers, Inc., which is a federally qualified health center. And I'm pleased to report that they've agreed to partner with DOH and the county to provide patient COVID-19 testing in the Brandon area of Hillsborough County. We believe this solution will provide additional outreach in the Brandon area to the Hispanic populations and others that might otherwise not be tested. We're currently working with Suncoast Community Health Centers, Inc. to develop the actual plan details to provide the testing. In coordination with Department of Health and our partners, the county is also planning to perform testing through two other smaller mobile sites that include Waimama and Sun City. And we're working with our partners to provide this testing on a smaller scale to enable testing in these areas as well. We believe this will further enhance our outreach to these vulnerable populations that's been requested by the members of the Emergency Policy Group. We anticipate this would be 1 to 2 days at each of these sites. We are still working out the actual specific plan details to provide the testing, but we are anticipating that these test sites will be set up as quickly as possible with a target start date of next week or the beginning of the following week. I'll stop there and answer any questions.
Ms. Snively, you recognize.
Thank you, Chair. And just wanted to thank Mr. Early and also thank the partners like Brad Harriman at Suncoast Community Healthcare for working with us to make those accommodations. I know that we do. I understand that we have mobile testing, but you know there are dire situations where we do need to go to a citizen for testing. But there are many people who are capable of driving that don't need to use the mobile services. They're very capable of getting in their car and driving, and that's a better use of taxpayer money to allow those people to get to those centers and make it convenient for them in a convenient location for them so that they can get to them. And so then that way we use when we use our mobile services, we really are using our mobile services for those individuals or those citizens who absolutely have no other way of transportation or getting to a center for testing. So thank you so much to all of our partners who have agreed to make more accessible our testing ability to citizens. And I just wanted to say thanks for considering that. And I look forward to hearing more information about the success of those locations. Thanks.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. And likewise, I'll piggyback on Ms. Snively's remarks. I want to thank you, Jean Early, for going down to Waimama. I know I requested that at an EPG meeting several meetings ago, and I think we talked about it soon after that. So I appreciate you going down there. As you know, there are language barriers, transportation issues for people to get to the testing sites. And though individually, like Ms. Snively said, the mobile van could have gone to each individual home, but I think we need to have a wider band on this and just be able to go down there and do more testing. So thank you all. Thank you very, very much.
Okay. Okay. Mr. Early, thank you very much. Job well done. Thank you.
Thank you, sir.
County Attorney update, Ms. Beck.
Yes, good afternoon, Chair Miller and EPG board members. Christine Beck, Hillsborough County Attorney. I think we've already covered most of the facts relative to the latest order issued by Governor DeSantis, which was Order 20-131. That was issued on May 22nd and related to youth activities, sports teams and leagues, youth clubs and programs, and child care. As I previously stated, there's guidance that's been provided directly from DCF related to this order, which is part of your backup. So I think it's probably best just to be available for questions. And the only other item under the update is the normal extension of the local state of emergency, for which, Chair Miller, you could entertain a motion on that.
Okay. Commissioner Merman, you recognize.
Oh, sorry, didn't put my hand down, but I'll make a motion to approve the extension of the order.
There's a motion by Commissioner Merman. Is there a second? Is there a second?
We'll second it.
Okay, we have a motion by Commissioner Merman. Was that Commissioner Overman?
Mm-hmm.
Yes, sir.
Okay. Okay, we have a motion by Commissioner Merman, second by Commissioner Overman to extend the emergency order. I don't see any further discussion, sorry. Please call the roll.
Miller?
Yes.
Overman?
Yes.
Was that a yes, ma'am?
Yes.
Thank you. Merman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
Motion carried 8-0.
Okay, we're now moving to EPG discussions. Is there anything that we need to discuss today? Mayor Lott, you recognize.
Just real quick, I noticed that we have a tropical storm that just hit South Carolina and is heading north. And there's been a ton of rain that hit 14 inches that hit Zinchen Beach and then 7 inches that hit Miami. I was just wondering if Mr. Dudley has any updates on our preparedness for the season that's becoming, and especially with dealing with the pandemic and also having to ration out the needs of being prepared for the hurricane. Just reassuring us that we're prepared. That's it.
I'm going to ask Mr. Merrill and Mr. Dudley to team up on that. Mr. Merrill and Mr. Dudley.
Yes, so the answer is yes. We've been spending a lot of time over the last 3-4 months working with our consultant on how we manage this now dual track kind of potential crisis here. And so, I think a couple of meetings ago, maybe, I can't remember now, Tim did make a presentation to the EPG, and I can have him send out a summary of that again. But we are looking at this from both points of view, primarily as it relates to sheltering. That's the primary area that is different than just a hurricane. And we're making provisions in shelters to ensure that there is proper separation, that all the precautions are being taken. I'm having a phone call conference tomorrow with Dr. Corral and others at USF to work out the final details on a mass casualty site at USF. Again, taking into account the necessity to have provisions for those who need to shelter but may be COVID positive. So, Tim, you can add anything that you like at this point.
Yes, sir. We've been working all the way from the state level. We've received a FEMA guidance document. The state will be producing their guidance document as it pertains to hurricane preparation. We're also having regular regional and partner calls, discussions of how our partners and what we can best do in all our communities. Here locally, we do have another meeting coming up with the school board officials tomorrow as well. Also, along with other partners. So we'll be having discussions of how we'll potentially do screening at the shelters. We'll be taking a look we're looking at opening more shelters to accommodate for CDC guidance and social distancing. So we're moving through our checklist of everything we would normally do for hurricane season, but we're adding that COVID response on top of that and some of those measures that we'll take. We'll be working with our communications department as well on how we want to best message on how we're going to utilize our shelters. Our shelters are always shelters of last resort. We're going to encourage everyone to start developing their plans, seeking families, friends, using hotels for those who may be in the area of danger if we do have to call those type of evacuations. So we're going to use every resource here in our community to ensure that we can respond accordingly to both disasters.
Thank you very much.
Ms. Snyder, you recognize.
Thank you, Chair, and thanks for bringing that up. And I know we have as mentioned, have a call scheduled for tomorrow, but I will assure you that being the primary provider for emergency shelters in Hillsborough County during these natural disasters, we have the human resources ready. The facilities have all been inspected, and any issues will definitely be finished by the end of this week to make sure that all of the locations, all of the 64 school sites that are identified for sheltering are all the physical features, the storm blinds, door coverings, and so forth are all prepared and ready by June 1st, the beginning of hurricane season. So I'll look forward to discussing more updates on that at future EPG meetings. Thank you.
Commissioner Overman, you recognize.
Thank you, Chair. This actually is two items. One, last week when we talked about childcare and communications, I had asked communications to come back and present to us the results of that. So in line with today's motion, I would like to recommend that our JIC or our communications team come back to us and actually report to us what that program looks like and what that communications is. Because one of the things that I've seen, if that's okay with everybody, I'd like to see that happen at the next meeting. One of the things I've witnessed is, the mayor and her communications team has been very robust in recommending, safe measures and safe acting and wearing face coverings. And for that, I truly appreciate it. But I'm getting phone calls from employees that are really, constituents that are trying to go back to work and talking with their employers and trying to get ready. And they are concerned about losing their jobs if they return to work and insist on wearing face coverings in order to protect themselves and their families. It surprised me to hear that employers would actually prohibit the use of face coverings by their employees and that use would result in a termination. I am concerned for our employees who are at high risk of COVID-19 or have family members in their households that are high risk, especially as we see children going back into group settings. And for the safety of our workers, I believe that we should protect an individual's right to wear face coverings in order to be able to support their families and participate in the public. There is sufficient medical evidence that supports the benefits of using coverings. And it's about protecting themselves and others from a disease that has an asymptomatic carrier element to it. So while it's a future discussion, I'd like to consider a motion. I know it's after our agenda items, but I'd like for the group to consider a motion. And I have run this by the county attorneys to verify that it is in fact within our purview to be able to do. But I'd like to move that all persons within Hillsborough County shall be permitted to wear face coverings in public and in private setting. And that's my motion.
You have a motion by Commissioner Overman. Is there a second? Is there a second? Is there a second?
Chair, this is Mayor Castor. Can I, in lieu of a second, can I just counter that and say, can we bring that back at our next meeting so that the county attorney can write it up and we will all be able to review that prior to, since we issue in the past with past.
I'm sorry, go ahead. Yeah, the motion was about to die for lack of a second. So if Commissioner Overman will just withdraw her motion and ask the county attorney to address this next week, I think that'll be a better way to do it, as you suggested. Commissioner Overman?
Thank you, Chair. I will withdraw the motion and ask the county attorney to bring us a order to consider in order to protect our citizens that are interested in returning to work without risking their health as recommended by the CDC. Thank you.
Thank you. Commissioner Merman, you recognize.
Thank you. And I wondered if Jean Early at our next meeting could report back to the EPG about behavioral health issues in the community as a result of the COVID crisis. There is a lot more requests. I know the crisis center, all the providers for behavioral health they're up to the gills with trying to provide services for people that are needing it. So I'd just like him to come back and report on the status of behavioral health services for people that have either had COVID, at risk of COVID, or just people in the community that are really developed issues because of the COVID crisis. That's all I'm asking.
Okay, thank you. Mayor Ross, you recognize.
Thank you, Commissioner. Just a comment on the previous motion that died regarding the right to wear masks by employees.
It didn't die, Mayor Ross. She withdrew it.
Okay. Okay. Before we ask the county attorney to draw that up, though, for our consideration, it seems to me like that would be better addressed at the BOCC level through the normal legislative process as opposed to the EPG. And that way it's noticed, there's opportunities for public input, feedback, and it goes through the normal process rather than an executive order by this board. And we do allow public comment, but our orders, the public input to us is much abbreviated as compared to the normal legislative process. So I'm not saying it's a bad idea. It just seems like this is the wrong venue.
Okay. Mayor Lott, you recognize.
Thank you, Mr. Chairman. I agree with Mayor Ross 100%. And I would much prefer seeing this taken up by the county, because this deserves a lot of input, a lot of research, and a lot of public input, and a huge public hearing, I would hope. Also, if we do bring this before the EPG next week, if the county attorney does so, I would hope that we would get that by Monday, Tuesday at the latest, so that we have enough time to sit down with our legal counsel and to get enough advice so that we can make an informed decision and a legal decision on it as of Thursday. I would, if we get it Wednesday or next Thursday, that wouldn't give me enough time to be able to have the chance to get enough data input and information, especially from the legal counsel that I use in our city here, to be able to make a valid vote on it on next Thursday. So hopefully this is just forthcoming. We get it with several days to be able to do our research on it. Thank you.
Let me say this. Since this EPG has been going through this whole pandemic issue, whenever we have an EPG member request our county attorney to bring something back, we always have allowed that to happen. So Commissioner Overman has asked the county attorney to bring this issue back. And I'm going to ask that Ms. Beck, is there, after you have heard what Commissioner Overman has asked, is there a possibility that you can have something in writing to the EPG members no later than late Monday or early Tuesday?
Yes, sir. Based on what I understood, it was fairly simple. So, just in terms of the language, so we will certainly bring that back as requested no later than Monday.
Very good. Thank you. Ms. Snively, you recognize.
Thank you, Chair Miller. I just wanted to get some clarification on, based on some of the public comments that we continue to hear, and I am getting contacted by constituents on a pretty regular basis. I don't know about everybody else, but I think that there might be a misunderstanding, or maybe we're not communicating it well enough, that the EPG is not the body of governing that decides whether or not playgrounds, pools, splash pads, sports fields, and the like are opened. And so a lot of people are, contacting me to say, EPG needs to open this up, open these places up. And I was concerned that there may have been some miscommunication, unless I'm wrong. But if Ms. Beck could clarify that, that would really, I think it might be helpful in addressing some of that to the public and some of the public comment we heard today.
Before I call on Ms. Beck, let me say this. Every piece of information that's been put forth by our being the county's communication department has indicated what the county is doing as far as parks and recs and those things go. It has never mentioned EPG. I don't know why people are not paying attention to what they're reading and saying that the EPG is responsible for opening parks, baseball diamonds, football, whatever the case may be. It's always been with the county. And our communication department pushed that out almost every day. I saw one day last week, they put it out twice in that day. So either people aren't reading it correctly, or not understanding what they're reading, that Hillsborough County has the authority to do that, not the EPG. For some reason, that's happening, and I get the same emails of saying, what are they missing here? What are they missing that the EPG has to do this and actually falls in the purview of the county? So, Ms. Beck, you can go ahead and comment on that, but I just had to say that. Go ahead, Ms. Beck.
Commissioner Miller, I don't think I could have said it any better than what you just said. You're absolutely correct. The EPG has not issued any orders relative to parks and playgrounds. It falls within the jurisdictions, whether it's the counties or the cities, and so it would be most appropriate for those comments to be made directly to the appropriate city or the county.
Thank you so much. And I know what you mean, Chair Miller. I've seen it on the government page. I know I'm trying to push it out. All I have seen is from the county government, the communication coming out. So I'm not really sure where there's a gap if folks are just confused about what we do as an EPG. But I concur with you, Chair Miller, that I think that the county's been really great about pushing out information. And I don't know why we keep getting contacted by folks thinking that it's an EPG decision. So thank you very much for continuing to clarify that.
To the public out there, the old saying that's utilized is read everything before you do anything. So hopefully that will work. Commissioner Merman, you recognize.
Thank you, Mr. Chair. And also EPG does emergencies only. Also, I wanted to ask, we previously voted down a mask issue. How is what is being researched by the county attorney different than the one we voted down previously? I don't know. I mean, we've already.
I'd like to be able to answer that if possible.
Yeah.
Well, yes, ma'am. You recognize.
Okay. We voted down mandatory mask wearing in public previously. Okay. What this request is allowing our citizens, our constituents, to the right to wear a mask in public and in private settings. Because right now there is no protection for an employee that needs to wear one or feels the need to wear one in order for them to continue employment. It's a guidance, it's a recommendation, it's all of those things. But when we're desperately trying to help people go back to work, the last thing we want is a bunch of fired people because an employer has decided they don't want people to wear masks in their employment setting. So that's where the line is. It's not requiring anybody wear a mask. It's allowing an employee or a person, a citizen in Hillsborough County to wear a mask in public or in a private setting.
Oh, I see. So you want him, if somebody's employed, the employer says, I don't want you to wear a mask, but she would say, I want to wear a mask. Is that right? Okay. And okay. Okay, that's okay. I'll be interested to see how that comes back. I'm not saying I'm for or against it right now, but I definitely think somebody's business is their business. And, if they tell employees, you're right, I don't want to see mass firings, but I think it kind of treads that fine line of what we can tell private businesses that they can do and not do in a way. So thanks.
Well, Lot, you recognize.
Sorry about that.
All right. Commissioner Overman, you recognize.
I'll make this quick. During the week, we received correspondence or a question regarding whether or not we needed to see the incident reports that our law enforcement is reporting to us regarding ways that law enforcement is actually adhering or helping people adhere to the social distancing, the gathering of individuals. and whether or not that was important and whether it related to safer at home. We are receiving those reports, and I think it's important for us to take into consideration where there are problems in our area, and if in fact we need to make further recommendations or orders to assist in helping law enforcement make those calls, because we're putting law enforcement somewhat in a difficult position when we're not being clear about what the recommendations are and what the rules are. And as we have probably seen, there's less compliance this week than there was 4 or 5 weeks ago. So those reports are helpful to see where there are violations. And I think that needs to be made clear to the public. When you violate these rules, there's consequences. And I think law enforcement wouldn't hurt to have that kind of support from the emergency policy group. So I'd like to get a report possibly next week on the kinds of violations or those organizations or areas that are at risk of creating a public health risk. So thank you.
Okay, I see no further hands at this particular point in time, so therefore that concludes our agenda for the day. We have another meeting, of course, a week from today. So therefore, there's nothing further to come before us today. We're adjourned. Everyone have a great weekend. Take care.
You too. Thank you.
Thank you.
Services. Please enter your conference room number. Conference room number accepted. If you are the organizer,